What's up, everybody? If you can hear me, I'm obviously live. I am just waiting for confirmation on the YouTube. And there we go. Welcome to the show today, everybody. I am talking about golfer's elbow. Golfer's elbow is something near and dear to me because I've had it multiple times and it is like gym herpes. Once you get it, it is just so damn hard to get rid of it. And if you don't know what to do, it is one of those things that just never goes away because you use your grip, you use your arms all the time. So it is very, very hard to fix it. And I'm going to share with you today how I got it, how I fixed it, and what you can do to overcome your golfer's elbow. And as always, this this podcast, this live stream has come from a question, and somebody asked a question. I can't remember. I couldn't find the question this morning. Rather, I should say I didn't look for it. I didn't have the time. But somebody asked, can you do an episode on golfer's elbow? So here I am doing an episode on golfer's elbow because it is just so damn common. And if you want to get the full strategy, if you want to know all about how to fix golfer's elbow, go and get the golfer's elbow rehab blueprint. It is free. You can head on over to unitygym.com/golfer's elbow, and that's going to give you the full strategy. It'll teach you everything about what I'm talking about here. So if you're somebody that prefers to read, if you want to see visuals, if you want to be able to look it over and review it for yourself, then that is where you will do that. So let's, I'm going to bring up some images here of the, actually that is not where the golfer's elbow funnel is. You're going to have to excuse me. I forgot that I haven't created a unique URL for that. So it's going to be one of those unitygym.com/5px1 URL. So just click the URL in the description of this video or this podcast if you want to, and it's not going to be there right now while I'm doing the live stream, but it'll be there when I finish. So I apologize for that. I'll find an image of the medial epicondyle because what golfer's elbow actually is it's called medial epicondylitis. And let me just bring this up here, wrist flexors. So you have what's called the lateral epicondyle and the medial epicondyle, and I'm trying to find an image of this here so that I can show this better. But it is basically the medial part, so inside medial, lateral, and it's all of the tendons that connect onto the epicondyle up here for wrist flexion. So it's actually the muscles that do that, and it's inflammation to the tendons of those wrist flexors, which is why it's actually called tendinopathy. It's called wrist tendinopathy. People used to call it tendinitis, but I've been told by Phil, our physical therapist friend who comes and does live streams with us and who helps me coach people and write programs for people inside our UMS online personal training. And he has corrected me so many times because we used to say medial epicondylitis. No, sorry, what did he, we used to call it tendinitis. Tendinitis, we've got tendinitis here. And he would always correct us and he'd just do it really gently and say tendinopathy, it's tendinopathy. So that is the more correct term for what you're dealing with. So what happens is you get an abusive load to these tendons. So it's basically, when you get golfer's elbow, you basically weren't strong enough for what it is that you were doing. So whatever you would, yes, Ash, I did say that I was going to make one on bicep tendonitis, which is actually called tendinopathy, not tendinitis, but I'm not going to do that until I've had a really good chat to Phil about that topic, because that is not something that I'm an expert on, and I'm not going to talk about anything with conviction that I'm not an expert on. I will not talk about a topic that I'm not very, very well educated on and haven't personally experienced myself. And biceps tendinopathy is not something that I have a lot of experience with. So I'll talk about it, but I'm going to do it after I've had a really good conversation with Phil, with my physical therapist friends before I do it. So, so you basically weren't strong enough for what you were doing when you got the golfer's elbow. So that can come in several ways. It can be an acute case, so you can get an immediate onset of golfer's elbow where you do something in one moment and you go and you do an abusive load and you get golfer's elbow. And it can come in chronically, where it's something that happens over time. And The both times I got golfer's elbow, it was a chronic abuse, and that's what most people deal with, because you use your grip all the time, so you're using your wrist flexors whenever you're gripping something and pulling. And people often feel it when they're opening doors, like when you're turning a tap, or opening a door, you'll feel your golfer's elbow flare up. It's just the most horrible thing. And when you're picking up your shopping, or whatever it is, like you just feel it all the time. So so what happens is, most people, they get golfer's elbow and think, oh man, this is really hurting, I'm just going to rest. And all resting does is reduce the inflammation. And because it is inflammation that you're feeling, so you'll feel the symptoms will subside when the inflammation goes down. But then as soon as you try and do what it is that you were doing before that was causing the golfer's elbow pain, it just comes back with a vengeance, because you weren't strong enough to handle what you were doing before, and resting now made you weaker. You lost even more strength. And so you're even more prone to golfer's elbow coming back now. So rest does not fix golfer's elbow. The only thing that fixes golfer's elbow is getting stronger. So I'm going to talk to you about the whole strategy about how you get stronger, because it's almost like a paradox with golfer's elbow, because you have to remove the activities that are causing the abusive load. So like whatever you're doing that's causing that golfer's elbow, you have to stop doing that. But you also, the things that you are doing that cause golfer's elbow are the things that are going to fix it. You have to get better at it. So for example, like it's a really common thing that people will get golfer's elbow in the gym from pull-ups or doing pulling exercises. And they actually need to get stronger and better at pull-ups for the golfer's elbow to go away. And I'll talk you through what I mean by that, because I know that's a paradox. It's like, how does that work? So if you're doing pull-ups, so for me, the most recent time that I got golfer's elbow, I got it doing pull-ups again. I was doing pull-ups 3 days a week, and one of my big rocks at the moment for my training is a one-arm pull-up. And it was actually, it's how I've done the golfer's elbow twice, is the pursuit of the one-arm pull-up. And it's basically, working on things that you're not strong enough. And I was trying to do progressions, doing archer rows and things like that. And that, the wrist flexors were the weak link, and it just wasn't working properly. And I'm going to talk to you about, actually, there's a lot more going on through the arm that causes golfer's elbow, but we'll get to that in a minute. So and by the way, if you watch these live streams and you haven't yet subscribed, please hit that subscribe button. It helps the channel, and make sure you hit the notification bell, because then you'll get notified when I go live. So you're not strong enough for what you're doing, but you need to get stronger at those things, and you need to remove the abusive load. So the first thing you've got to do is you've got to recognize that you go to the gym, you do all these exercises you can't do a whole bunch of exercises, and it's almost always going to be things that are associated with gripping and pulling that are going to cause the golfer's elbow. So we need to find variations that you can do without pain, so you can still keep strengthening your body. So for example, for me, I stopped doing pull-ups and I replaced pull-ups with ring rows, because ring rows are a really easily, you can control the intensity really easily. So just by the distance, by the height that you set the rings up, and by how close your feet are to the anchor point of the rings, or how far away they are, is going to determine how hard it is. And you can make a ring row very easy. Like you can do a one-arm ring row. You could do a one-arm ring row with 2 fingers just by bringing your feet far enough back. So, by basically just having very little weight in your arm. So it's a really good way that you can regress that pulling motion, the pulling pattern, sorry. And a ring row uses exactly the same muscles that a pull-up uses, but it uses them in a different way. And so you're still training all of that same muscle system. So I was still being able to train the pulling pattern, but I was able to regress it. And so the other thing that you can do with golfer's elbow is that you can change the grip. So for example, bicep curls in a supinated grip are no bueno when you've got golfer's elbow. It just puts way too much strain on those wrist flexor tendons, and you'll feel it straight away. But as soon as you go to a neutral grip, you will be able to do bicep curls. Most likely, your golfer's elbow would have to be on a very high spectrum of severe to not be able to do neutral grip bicep curls. And this is something that I haven't explained on one of these live streams for a little while. It's called the issue intensity continuum, and I'm actually reminding myself now that I am going to make a graph to be able to show how this works, because whenever I explain it, I always imagine that I'm making a dog's breakfast out of it, but I'm going to do it anyway, because this is really, really important to understand the issue intensity continuum. So what you imagine is that if you have on this axis, so the y-axis, you've got your issue, and down here you have 0, so you have no issues at all, and up here you have 10. So that's the worst issue that you could have, the worst injury you could have. You're in hospital, you can't move, you're on a bed, whatever it is. And then on this axis, on the x-axis, you've got your intensity, how hard you want to train. Okay, and down here you've got 0 intensity, and here you've got maximum intensity. And so what happens is, if your issue down here is 0, then you can train at a number 10 intensity. You can train as hard as you want. But as your issue goes up, if your issue goes up to 3, you can only train at a 7 intensity. And if your issue goes up to a 7, you can only train at a 3 intensity. And if your issue goes up to a 9, you can only train at a 1 intensity. So there's this inverse relationship between how bad your issue is and how hard you can train. And that's a really hard concept for a lot of people to get their head around, because everybody wants to be able to train hard and nobody wants their injuries to be able to get in the way of what they're doing. But when you have an injury that's preventing you from being able to train, your number one goal should be to fix that injury. Because if that injury is stopping you from being able to train, then everything else should come second to that, because it's always going to be there stopping you from being able to do what you want. And rehab is not being in the naughty corner and not being able to train. Rehab is training in the presence of injury. So it's not, I've got golfer's elbow, I can't train anymore, I'm going to wait until it gets better. That's not how it works. You train in the presence of golfer's elbow, but you have to change your program to suit your to suit the issue that you've got going on. And so here's some things that can work and work really well. In the early stages, you can get wrist wraps, and I got the really strong wrist wraps, the hook wraps, the ones that have the metal hook on them that hook around your wrist, so you can grip onto something. And I was after about a month or maybe 8 weeks, I was doing pull-ups with wrist wraps where I wasn't even gripping with my fingers. So I was basically just kind of loosely hanging, and all of the weight was going in here, but I was still able to pull myself up and do my pull-ups. So that's really good, because that deloads the wrist flexors and you're able to still work. You change the grip of how you're doing your pulling. So I talked about that. So once I got rid of the wrist wraps, I was able to go to a neutral grip, and I was able to do pull-ups, and I was doing neutral grip pull-ups for ages, because the supinated grip would just trigger that bicep, the golfer's elbow pain. You also have to do wrist flexion and wrist extension, not because wrist extension helps the golfer's elbow at all, but just to create structural balance in the arm. And often if you get golfer's elbow, shortly after you can get tennis elbow. They often come like a double whammy, because it's this systematic breakdown or systematic lack of strength. And then and so you need to strengthen the wrist flexor tendon. So you need to do wrist curls and you need to do wrist extensions. And then also pronation and supination is important as well, because tennis elbow is associated with a lack of strength in the supinators. And it's a global issue as well, golfer's elbow. Golfer's elbow is it's something that's going on through your whole body. There's a lack of strength systematically. And then the other thing that a lot of people don't understand about golfer's elbow and overlook is that you have to address scapular strength, scapular retraction and depression. Because what happens is, if you're not retracting and depressing your scapula effectively when you do a pulling pattern, so anything where you're rowing or anything where you're doing a vertical pull, if your scapula isn't moving properly, then that's my alarm telling me I've got to go and teach my class. That's your scapula. If your scapula is not moving properly, then you have a dysfunctioning pulling pattern. And if you have a dysfunctional pull pattern, so for example, if you go for a pull-up and you don't initiate by depressing your scapula and you pull like this, then your lats are doing very little of the work. You're really relying on your bicep to do the work. And then when you're relying on your bicep, the bicep does the body does whatever it can to get up there more, and it puts too much load and too much strain on the wrist flexors, and the wrist flexors do bugger all to assist you with a pull-up, but they are active, they're there, they're helping you to hold onto the bar, and then you get this abusive load. And so golfer's elbow is this systematic breakdown of what's going on. So I'll recap for you again, because I do have to go now. So you want to deload the wrist flexors by using wrist wraps. You want to continue training, do not rest. Rest will not fix this, but you need to reduce the load on those wrist flexors. So the sad thing means is that when you go and do your upper body workouts, you're going to be training for the strength of the weakest link. So you're training for the strength of what these little suckers can handle. And right now they're inflamed, they're swollen up. So then they're not going to be able to handle as much as you want. So these guys here and these guys here, they're not going to be feeling like they're getting a great workout if you're somebody that's strong. You're going to be doing an amount of weight that feels like, oh man, I barely got started. Well, that's just what it is. And if you get this right, you will start to feel a reduction in inflammation very quickly. And you then change your grip. So do not do a supinated grip. Even a pronated grip can be problematic. I was getting even some symptoms when I was doing pronated grip pull-ups, but a neutral grip is really good. Do wrist flexion, wrist extension work, do pronation and supination and pronation work. And absolutely go back to basics, working on doing rows. I really love ring rows. You can do a bent over row if you want, but ring rows are beautiful because they're a closed kinetic chain movement. It has a great carryover to pull-ups. And really focus on what's going on with your scapula and pulling. And then the last thing that I'll say is there's some really, really good self-massage techniques that you can do. And if you go to my YouTube channel, I will link it in the description after this, but I'll just tell you guys, if you go to my YouTube channel and search for Your Golfer's Elbow Treatment and Complete Rehab Plan, that's a really, really good video where I actually scripted what I'm talking about now. So I spent some time thinking about all this and planned it out and edited it, and I show you the trigger point technique. So I show you how I do it, because it's not just with a massage ball. There's also some self-myofascial release that I do with a physio floss band as well. So that's really, really, and it's really, really effective because the tendons get low blood supply. They don't get as much blood supply as the muscles. And so we want to try to stimulate blood flow to there. And that's what trigger point release and the physio band flossing can do as well. I hope you guys learned something about that. It's always a little bit rushed when I have to run and do a class, so I apologize. I have to wrap it up. But if you guys have any follow-up questions, put them in the comments. If you haven't done so already, subscribe to my channel and hit the notification bell so you guys get notified when I go live. I'm making a commitment to go live daily, and I haven't missed a day yet. At least Monday to Friday I'll be doing. I've got family duties on the weekend. And thanks so much for tuning in, everybody. I really hope that you learned something from this, and I will see you tomorrow.